I think certainly that's an aspirational goal that we can all work towards. We should all work towards making healthcare a right, not a privilege. And it's shameful that we're an industrialized nation and there's still many people who don't have health insurance or the type of access to health insurance. I think what we need to do is protect the gains we made and work in a bipartisan way, as we've done in Problem Solvers, to try to get to a point where we continue to build on those gains. Let me share a few of those with you. A public option would be really great. When the Affordable Care Act was passed, there was one senator that was the critical vote with that being included. That was Senator Lieberman. He was the one who held out, if I remember correctly. But if we have that in place, it would again create more competition. And in areas where you have a private insurance who, for whatever financial reasons can't be there, the public option could exist and it could provide better competition. So that's one. Cost sharing subsidies. We need to make sure that that's no longer in the hands of an administration, but gets funded every year through the United States Congress, so that we don't have the instability issues that come about because of that uncertainty, where an administration, a president could try to withhold those subsidies. The courts, as you know, are in the process of dealing with that and addressing that. And I believe they said, I'm not sure if that's been adjudicated completely or not, but it's in the courts. We need to provide Medicare, like we've done the VA, an opportunity to leverage their procurement authority and power to bring down prescription drug costs and pass those on to our consumers, especially those that utilize Medicare. There's other things we could do. We need to get rid of some things that I think the iPad, the so-called panels that could recommend reducing Medicare benefits. I voted for legislation that got rid of those panels. That's one thing I've done. Getting rid of the so-called Cadillac tax is something that I think we can get rid of, and I've worked and voted to get rid of that part of the Affordable Care Act. So I believe the Affordable Care Act is great. It's done a lot of good. Is it perfect? No. Should we work on the gains and make it better? Yes.